The typical protocol or the routine protocol is going to be a 3 injection series where 1 injection will be right into the core lesion, which will actually be done with an ultrasound where you can identify that the tip of that needle is directly into the lesion. Approximately 0.2 to 0.3 mils of the product, the chemical brace, will be injected to there, and then an injection about 3 to 4 centimeters above the injury and 3 to 4 centimeters below the injury. The purpose of this is to provide scaffolding effect not only at the lesion itself, but a little bit above and below to prevent that lesion from either gaining above or below the actual core lesion or the injury site.
Today I will show you how to prepare Novobrace for injection. Novobrace is easily reconstituted for injection and once prepared must be used within 1 hour of preparation. First, we gather and prepare our materials. Tuberculin 1 ml syringes, as many as you need for the injection procedure, a 3 ml syringe, and several 22 to 25 gauge needles, non-sterile and sterile gloves, and the Novobrace 2-vial device. The next step is to open all of our supplies onto a sterile area. The sterile glove paper works great, or you can use a metal tray that has been cleaned and disinfected. Once everything is open, we will reconstitute the Novobrace cross-linking solution. We recommend you wear non-sterile gloves for this part because if Novobrace comes in contact with your skin, it will stain it temporarily blue. However, if you do get it on your skin, don't worry, it's harmless and it'll wear off in a few days. Washing with soap and water after contact will reduce the chance of a stain. With your gloves on, use a 3 ml syringe to draw up 2 ml of the clear solution from vial 2. Add this to vial 1 and shake. As you can see, it forms a clear yellow-brownish solution. In any event, do not administer the device until the reconstituted device is in solution without any visible crystals or seen substrate. It's important to note this must be done at room temperature, otherwise the product will not reconstitute. A common example would be an extremely cold region or almost any barn in December. In that instance, we recommend you warm the vials by holding them in your hands or warm them in your truck for a few minutes before combining them. Now, using sterile technique, draw up the desired amount of Novobrace into your syringes. I recommend preparing separate syringes with the amount you will need for injection. For example, today I will be treating a small superficial digital flexor tendon lesion. So I will draw up 3 syringes with 0.2 ml in each syringe. This ensures that I have both the correct amount in each syringe and I will also inject the correct amount. This is essential for the best outcome. Replace the old needles with new needles. I recommend using the smallest needle you're comfortable with. A 22 or a 25 gauge needle works best. Novobrace is now ready for injection into an equine tendon or ligament.
After the horse is sedated and restrained, the leg is routinely prepped for a local injection. The injection occurs at a site above where the lesion will be injected. Once the local anesthetic has been applied, a routine sterile aseptic prep of the injection site occurs. After the leg has been sterilely prepped, a sterile glove is placed over the ultrasound probe prior to injecting. Using the ultrasound probe, the lesion is identified on the leg. Once the lesion has been identified, the product, Novobrace, is injected under guidance of the ultrasound into the lesion. A 22 gauge 1.5 inch needle is routinely used for the injection. Once the lesion has been identified, the Novobrace is injected into the lesion, 2 to 3 centimeters above the lesion, and 2 to 3 centimeters below the lesion.